All right, the recording has started. Welcome to Indian Occupational Therapist Think Tank panel discussion on private practice of occupational therapy in India. We are celebrating our occupational therapy day and a month in a way from October 27 to November 26. So as part of it, we had a wonderful webinar. The speaker was our own Dr. Suresh Kumar Kamalakan, and it was held last week. The recording will be, it's been recorded, but it will be made public soon. And also, this week we are having this panel discussion with some of the very successful private practitioners in India. And then next week we are going to have an expert talk from a neuro practitioner who has been very successful in neurological based practice in Bangalore, India. So that's going to be next Saturday at the same time, 7 p.m. We look forward to, for all of you to join us on that as well. In addition, very soon we'll be launching our workforce survey, IOTT's Indian OT workforce survey. And the idea is that to gather that data and then like prepare an executive report and make it available to all stakeholders through IOTTT website. Again, IOTT membership is now open to everyone. So if you're interested, if you're not a member yet, please join us to empower the field of OT in India. That's our mission. Whatever we do is to make occupational therapy a scientifically vibrant profession in India. And, we are gaining traction. People are joining us, and we are trying to put our efforts, but we need more hands to do more things. So I would sincerely appreciate all of you consider joining as a member of IOTTT if you haven't already. All right. So without further ado, I would like to, invite our panelists today. So we are supposed to have four panelists, but I think one person is having some difficulty joining, so hopefully he will join us soon. But I'm going to have the panelists, as part of their introductory speech, they're going to introduce themselves a little bit, and then also like about their practice. So we have Dr. Shobana Murthy and the owner of Smart Sensory Kits. And then she had her practice for a long time in Chennai, and now she also has same practice in Ireland. And we have Dr. Pooja Mehta, a private practitioner in Mumbai, and we have Sarika Sasi, a private practitioner in Chennai. And then we will very soon, I think Dr. Murali Krishnan will also join us, who is also a private practitioner in Chennai. And all of these, practitioners, they have been private practitioner, if I'm not wrong, at least for a decade or more than that. Without further ado, I'm going to like start off with some of the questions I have to moderate this discussion. If you do not know me, like my name is Karthik Mani. I'm the president of the Indian Occupational Therapist Think Tank, and I work as an associate professor and program director in a public university in Texas, United States. All right, so panelists, thank you for joining us and willing to share your experience and expertise with us today. Can you each briefly describe your practice setting? First of all, briefly describe yourself and then describe your practice setting, and also just add on what initially motivated you to start private practice, and then if you could wrap it up, how it has evolved over time. So it's like four-part question: introduce you, describe your practice, and what motivated you to start your practice, and finally how it has evolved over time. Let's start with Dr. Shobana Murthy.
Hello, everybody. Thank you so much, Karthik, for the introduction, and thank you for coming up with this idea of having a wonderful panel discussion. First of all, I would like to apology if I was sick the whole week, and you may have some cough and noise over here, so I might mute myself. Is it okay? Well. About myself, what could I say? I am a very passionate occupational therapist, and I have an experience of over 25 years across the clinical practice and also teaching and research. I began my career working in various settings where I was also tutoring at the very early stages in my career, and over time, I found my true passion in pediatric occupational therapy practice. And also, I am very, very like fond of family-centered care approach. So I spent several years in a senior role in Ireland as well as in India. And then in around 2012, I moved back to India, where I founded Smart Sensory Kids to support children with developmental and sensory needs. Alongside my clinical work, I've been also actively involved, in recent years in research and have published in occupational therapy journals. And I must thank the Indian Occupational Therapist think tank, who played a major role in inspiring and guiding me in my research journey. Um, and now I'm back again in Ireland, and like I am working as a part-time senior occupational therapist with the health services executive. Also, I run my own private practice here, in Dublin. And what was your second question? What motivated? Is it to start my private practice?
Yes,
Well,
yes.
yeah. So I must say that from the very beginning, I've had a deep passion for occupational therapy, especially in pediatrics, and for truly, family-centered care. When I graduated as an OT, the awareness in India was still growing, but I watched some of my colleagues who built the private practice in India when I was in Ireland. And I just kind of, that was very motivating for me, number one, because I always dreamt to have um, a, a private rehabilitation center exclusively for occupational therapy. Like that was my early stages in my career. I always dreamt about having my own, like OT rehabilitation center, like how, like in back home, all the physiotherapists have their private practice. So I dreamt about like, why not having an OT practice? That was the time. And later, I realized that, like the awareness of OT in India was very, very challenging. So, but anyway, looking back, I also realized that I have always had an interest in private practice since my time as a student. During that period, during my college period, I volunteered part-time in private practice and also continuing my college years throughout, And I remember advocating for occupational therapy and helping people understand that I'm not a physiotherapist. My journey of, like occupational therapy, been always advocating of what occupational therapy is, So I say that part of that also motivated me to start a private practice in India. Yeah.
Thank you. It's so ironic that you mentioned about trying to help stakeholders understand the difference between PT and OT. I'm attending the Texas OT conference now here, and the keynote speaker yesterday, who is like a veteran OT, worked for like 20 plus years in the U.S. military, had the same issue. He has to explain to others about the difference between PT and OT. So it's pretty much everywhere.
I say
I
it
think.
never ends.
All right, let's switch on to Pooja now. Dr. Pooja Mehta, please go ahead and again, the same questions to you. Tell a little bit about yourself and what motivated you to start your private practice and what area of practice it is.
So, I mean, to give you a background, I belong to a family of doctors, all of whom have private practices.
It's in
So,
your blood.
right from my childhood, I mean, so I used to live in a house which had a clinic in it, you know. So, one of the room was a clinic. So, right from the childhood, I mean, to be in that clinic was kind of our hide and seek game also, that we would hide in the clinic. And so I have seen my father working as a private practitioner, my masa masi, my fua, They all are different medical professionals, all with their private practices. And then my elder brother went into a medical profession. So, and he too has a private practice right now. So maybe it's in blood and genes as well. So to start a private practice was not. I mean, I never thought of anything else except starting a private practice. So to give you a background regarding my practice setting, so I majorly work with a pediatric population, mostly neurodevelopmental disorders. So 80% of my population, the age group is around 2 years to 12, 13 years with autism, learning disability, ADHD, any syndromes or genetic conditions. And hardly, I could say 1 or 2% is cerebral palsy, which hardly now, anyways, the prevalence rate of these kids have gone down. And the remaining is of mental health. So I also work as a mental health occupational therapist, majorly for teens and young adults. So initially, I started with teens, having anxiety issues, depression, um, screen time addiction, not wanting to go to school, boredom. Everything is boring. I don't want to do this. I want to do that. So it started with that, and now it has included young adults who have anxiety, depression, or alcohol or cigarette use, and maybe even stress at work, not able to cope at work under pressure, and similar boredom of I don't know what I want to do in life. These who have just uh, graduated and are placed in a good jobs, but they still don't want to do the job. So these kind of uh, practice scenario is what I have. I'm specifically more on a cognitive perceptual executive function practice than
Got
SISI
it.
practice. So more of occupation based interventions are what I expertise in. More of
Got it.
enabling you or empowering you to do your work or what is expected out of you. Meeting demands with the capacity is
Excellent.
what I,
Excellent.
and that's how I explain OT as well to most of my parents, that we are here to empower you with skills so that you can meet your demands. Those demands could be anything. So it could be academics, it could be socialization, it could be communication, it could be interaction, it could be leisure or hobby development, which most of our kids don't have. It could be mental health or emotional uh, expression of the
Thank
child, or it could be as simple as the family as a unit. Because in an Indian scenario, most of us have joint families, and child doesn't come as a child. Child comes with a package of a family and their family issues.
Got it.
So
Got
even
it.
those
Great.
issues. So over the time,
Yeah.
I've gone into that as well. That I work with the emotional issues and the clashes in the family, and then trying to sort things out there so that the child has a better scope of thriving and successing uh, in his roles. So that's how. And so that's the
Thank you.
background and the practice setting.
Excellent.
Motivation,
I just
yes,
want to,
definitely.
sorry to interrupt. I just want to highlight one thing before I forget that, because like as you really said, right, we don't really need to label or give a diagnosis to all the problem. There
Yes,
are people, have challenges in life that an OT could help. And I really love the way you said, like, how just the person can do the job, but he or she doesn't want to. There is a lack of motivation. There is a disinterest. With I think the changing lifestyle, there is a lot of these new, things come up that doesn't, we don't have a label for them. And we cannot give them, like, treat them as a patient, but still, like, they have challenges in life that an OT could help with their expertise. And like, I'm glad that you're able to address those things in your practice. And I mean, like, till date, I share this story with my students when they ask about, like, tell me the best OT experience that you ever had. I'm going back 20 years down the lane, like, in my first year of OT practice, exactly the same thing. One of my, psychiatrist friend, he's just kind of like, I don't know what to do with this, but he doesn't have any diagnosis per se. It's just simply
yes,
he's unable to sustain any job. So he just sent it my way. all I did is basically assess his skill set and then gave him a letter of recommendation. Based on your skill set, these are the type of job would better suit you. And then I sent it. Only two visits. One visit for assessment, second visit for consultation. That's all I did. And then after 1 year, I got a call from that person's mom that he successfully completed 1 year at the job, and that was the best moment I felt as a clinical practitioner back then, and I still share that story with my students. So I'm so happy that I mean it's been there, but I think I really want all the audience and everyone who's going to listen to this recording to know these type of things, instead of thinking only pediatric practice, psychiatric practice, and all like. You could just be that person, if you have any difficulty and challenges in sustaining a job, OT could help you.
Yes.
If you have like a lot of lack of interest in your day-to-day living, OT could kind of help you. They can analyze why that is, and then they have some toolkits in their toolbox that they could use. Thank you. And again, yeah, we need to be mindful of the time. So I'm going to switch on to Dr. Sarika Sasi. The same questions. Go ahead and talk a little bit about your practice and what motivated you to start your practice.
Hi, sir. Hi, everyone. Thank you for inviting me. And I'm Sarika, and I'm an occupational therapist for 15 years now. And as I said, I have a clinic here in Chennai, which is the North Chennai, which is very well known for all the, where usually it is called the poor people's area. I was brought up here. We had a business here and born and brought up in North Chennai. So wherever I go, I did my bachelor's in Savita and I did my master's in Brighton University, London. But wherever I go, the freedom that I had in the North Chennai, I didn't feel it anywhere. So I always wanted to come back to this place. I worked in Kerala for a year and then I worked in Bangalore for a year. But I felt really happy and the freedom that I had in North Chennai was incomparable. So I always wanted to come back even after working in London for 3 years. So once I came, mine is actually a multidisciplinary clinic. Once when I started, the motivation to start it was just that I have to escape from London. It was very thing like I don't wanted to, for some reason, I don't wanted to live there. I don't wanted to stay there. So I had to find a reason to come back. I came back, but I couldn't start my full-time clinic as soon as I came back because I was working for a private hospital in UK where I had to finish my work. I have to do their paperwork from Chennai for like almost 2 years. I continued it in the morning. So morning hours, I used to work for them from India. And after 2 p.m., I'll do my OT work. It was just an OT clinic when I started. 2 to 5, I was working for just 3 hours. And then now it has turned to a complete clinic where we have a remedial therapist, special educator, psychologist, physiotherapist, speech therapist. We have even to say we have a couple of receptionists, administrative assistants, and everyone. We are a gang of like 12 women. So once you come in, you'll be like, where did all these women come from? And we are a group of women working here and supporting each other. And it all started like kind of I wanted to be in India. That's why I started actually. But then it emerged as a place where I started to help people both mentally, physically, and however it is possible. Because this is an area where people, though you see lots of educated people here, they're all from the current generation. If you want to talk to the grandparents, you have to go down to the level, use the colloquial words, colloquial language, and tell them, see, this is what we have to do. The mother could be an IT head or doing wonderfully well in her IT field. It could be on, even a gynecologist. But when it comes to the taking care of the children, the grandmother takes this stand there. So the grandmother will say, no, you don't know. Even if it's a gynecologist or a pediatrician, she'll say, no, don't do this, do this. And I have to get down to the level and tell them that, see, I know your daughter is a doctor by profession, but you may be knowing better than her. But see, this is all is lagging in this child. This is all is happening with the child. So we have to pay attention. So one good thing that I've been doing, which I'm very proud of, is that I let the parents to be in the therapy center during therapy. So they'll be with us. So the grandparents are the one are usually coming with the children. So they'll be with us. They'll ask me every time, every minute when I'm doing something, they'll ask me, why are you doing this? Yeah, be pandering. The kid may fall. And then I have to explain them. These are the reflex integrating patterns that we have to do. And once you tell them, they are like, it is very, very much easier to work with the grandparents when you explain to them properly than the parents actually. But in the initial stage, it is difficult. So this is how it's going on now. And I also started a preschool because I was so much getting into these children with special needs, and I totally forgot how the normal children will behave. So I started a preschool to, tell me like, no, see, these are the normal things. And I've started by working with these children for 15 years. Even when the child was not speaking at the age of 2, I was like, okay, all children are started to. I got into an idea like, oh, children will, speak delayed kind of stuff. So I wanted to start a preschool. We also have a preschool which is maintained by a trust. Half of the children are paying the fees. We can pay the fees, and half of the children are not actually paying the fees. So I'm doing it as a kind of like helping people as well. Even this is happening in the clinic in the background. So this is how
Awesome.
it's
Awesome.
going. And these are
Mhm.
the things that are motivating me to go ahead even after all the work that I'm continuing to do.
Yeah. One theme that already emerged is a family-centric practice. India is, like family unit is pretty strong in the Indian culture. I think, engaging the family is a very critical aspect for OT practice. And I think we need to document that more, write about it more. Suresh would agree, definitely. So I think we have the fourth panelist here, last but not the least, Dr. Murali Krishnan. Welcome. So please just
Hi.
briefly talk about your practice and what motivated you to start your private practice and how it has been progress so far.
Okay. No, for me, it has always been coming back to my base. So wherever I go, coming back to Chennai was the final goal for me. Then when I went to Mumbai, it's refreshingly eye-opening for me because uh, it's a lot to take in from cultural aspect. It's a lot to take in from knowledge aspect, and I think I'm one of the lucky few because our batch was the last batch to do PG in Mumbai corporation hospitals. So I'm thankful for the education system there. So we get to see a lot of people, and I have learned a lot. But clinically, what I have learned is through my seniors there, through my juniors there, fellow therapists who have taught me so much on how to go forward. Because theoretically, I was fantastic in my UG itself. But where I was lacking is the communication and how to put my knowledge into practice is where I was lacking. And I could sense that once I saw them working with the children and working with the clients. And I completely decided that once I finish my PG, I'm going to go back. Um, but the idea I had in my mind before finishing my PG was something which was resonated very well with the center in Mumbai, Umid Child Developmental Center. I had this imaginary setup. This is how I want my setup to be. This is how I want to deliver a service, and this is how I want to receive and address the issue. Everything was already there in place. So I was surprised knowing about it, reading about it online, and I decided I'll apply and I'll go join there. And the first thing I told my MD, Vibha Krishnamurthy ma'am, and fortunately I had Anjali Joshi ma'am also there in the panel joining me at that time. I told them I'm going to be here 1 year. I'm going to learn all the trade secrets from you, how to work, how to run an organization, and I'm going to go back to Chennai and start something like this. It was a topic for discussion for them, and I think Viva ma'am liked the idea that I'm there. I'm openly telling her that I'm going to learn from you and then go back and start my own practice. So they gave me a year there, and I stayed exactly a year there. And before that, I was much into a neuro guy, adult neuro. I'm very comfortable, very interested in it. So Nirbal Surya sir, who gave me the base for it in the clinical practice side, of course, other than my teachers there in Mumbai colleges, I would say. Then when I came here, of course, you're coming in, you're from a village, and then you're trying to settle down in city. You need to earn money, and then you have been doing that in Mumbai. So when you come back, you're trying to find your foot. I joined NIPMED, Central Government Institute, and somewhere down the line, probably within that 1 month period, I kind of realized that I'm not a government job material guy, and I told my director then and there, like, ma'am, I think I'm not suitable for this particular position here, so I want to leave. Then she said, no, 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 finish the at least first 3 month term, and you can take a call. So I finished it, and then also I was not convinced, so I left the job and I came back, joined a school as a school-based OT in 2009, and started my clinical practice in 6 months' time. Learning experience. And I was kind of, groomed by like someone like AJ ma'am and Pooja and Payal, Preeti, all Chaula Badiani, one of the person there. And I still respect them for the information or hands-on training they have given me. So that has given the confidence to work with. So I started here, and this is my 20 years plus in clinical practice. Now I have two centers in Chennai, now shifting between both the centers. Other than that, what I would say is I have established myself not just pediatric, not just adult neuro, not just psychiatric, even into ergonomics and in a little bit in ortho, especially when it comes to whole shoulder rehabilitation. On the whole, I'm doing an OT clinic as uh, I'm exclusively keeping it as OT clinic. The new branch, of course, yes, has a speech therapist and special educator also in, but my main branch is still exclusively an occupational therapy clinic. Attracts a lot of psychiatry and neuro clients as well, as much as it attracts pediatrics. I completely agree
Excellent.
with Sarika here, because that's the thing. First thing which I learned in Mumbai is having the clients there, having the parents in your center, and with the center, with the sessions, and then training them. That reduces your burden so much. I do it for my selfish reasons, because when I have them inside, my question answer sessions get reduced, my workload gets reduced, they take up the responsibility,
Agreed.
and responsibility as in they do a lot at home because they understand what we are doing in the centers, and it gives a lot of improvement for us, and that makes it successful. That's also the reason.
Excellent.
So this is how it is
I,
going. Recently, I had one of sorry. Recently, today I had my parent meeting because of the Children's Day celebration. One of the parents said, like, I stayed with you for 3 years now. You have discharged me from the center today. So I invited them to give a talk to parents, because most of the times the duration of the therapy differs in clinical practice, and then we have to sustainably tell them that why it is short for somebody, why it is long for somebody. And I called up someone whom we have discharged in 7 8 months, and then they stayed with us for a year. Somebody who wanted to get discharged every 6 months, they would ask, and then I pulled them till 2.5 3 years. Now I'm discharging. So I kept both the parents, and then I told them to address the parent community, and it brought in a lot of eye opening for them. So my interest, why I'm staying here, is I didn't know what OT was, as like most of us would say. And then when I started doing it, it started changing people's life, especially not just a person. It started changing the family's life altogether. So I thought, what better way to serve the community on the whole? Thank
Great,
you.
great. I wish all your mentors that you mentioned listen to this, recording. They will be very happy,
I
that you
missed a
acknowledge
few,
them.
so I missed a lot. But yeah, all of them
Make
are
sure
my
that you send the
mentors.
link to
I
the recording to
respect
them.
them. Definitely, definitely.
Yeah, sure. And also I love the way that you really mentioned, like, have the parents who, got discharged from therapy talk to the other clients. That's very powerful, because
Mm.
they all, like, kind of sailing in the same boat. They all experience very similar issues, and that can easily resonate with them, because there is this clinician client hierarchy is no longer there, right? So they're just going to
True,
honestly,
true.
like, share their experience, and that's really going to resonate. That's a powerful method as well. Thanks for sharing that. So let's move on to the next question. So we are functional experts. Occupational therapists are functional experts. So, what type of functional challenges do you see in the Indian context, among your clients? And how is, like, talk a little bit about how do you collaborate with other professionals, in the service delivery in addressing those functional deficits. So again, it's a two-part question. So one is like, what type of functional deficits do you see in the Indian context? And second thing, how do you go about addressing those functional deficits in a multidisciplinary or interdisciplinary team method? I would like to get started now with Sarika first.
The functional challenges, I don't know whether I'm answering it right. If the functional challenges that I face here is like explaining to these parents about sensory integration disabilities. They never understand it.
So in terms of the deficits, what are the complaints they're reporting to you? My child is not sitting in the school. My child is not giving eye contact. Like, so what type of complaints they're bringing it to you in terms of the challenges
The one
experienced
and
by your
only
clients?
complaint they mostly say is my child is not speaking.
Oh, okay.
They can't speak. There's nothing else wrong with the child. That's a major thing. Every parent will come to you. Even if the child is not sitting for a minute, even if the child is running around, they'll say the child is very active. He's just like his father. He's just like his grandfather or something like that. The only thing that bothers the parents is that the child is not speaking. If the child is speaking and if the child cannot sit in a place, joint attention is poor, and all these stuffs are if he falls into all the ADHD category, but if the child can speak, parents are never going to understand that the child has a disability. Child has some difficulties. Recently, lots of CBSE schools, state board schools are not sending those children for any assessments. CBSE schools have started sending these children to assessment, and even when they come, they'll come with a big complaint about the teacher, saying that the teacher doesn't like my child. That's why she's doing all these complaints, giving all the complaints, and there's nothing wrong with my child. They are very happy the child eats whatever they give. Maybe even if it's a picky eater, they'll compare the child with somebody else. It is the most toughest thing that I have been facing right now, actually, to tell them these are the sensory issues that the child is having, and these things has to be done. And especially the play method that we follow. It looked very childish for these parents and the grandparents. Actually, they'll be like, they used to do all this in their preschool. They used to do all these in their play school, and why are you doing all this again here? And when we introduce those sensory stuffs into the play, and when the child is like doesn't want to do it, the parent will be like, he doesn't like it, then why can't you stop it? To make them understand what is happening, and even if there is an improvement, recently with the I would say like 90s parents or the recent young moms or young parents, what we face is that they are never understanding the fact the sensory issues do affect them. And they are more worried about the child learning phonics than the toilet skills. Even at the age of 5, the child is still in his diaper. I have been having child who's 11 years old, still in diapers. They say he's afraid to go into the restroom. That's all. But they were more worried about him speaking English in an US accent or UK accent. So make this and make them understand is a real issue. And every time when we show an improvement, it is almost like they did something at the home and the child started showing improvement. Whatever we did was like nothing. So I have a practice of writing everything that's been done in the center on the day. It's a notebook that I maintain. One copy is with the parent, and I'll have a digital copy of it. And so it is written, and if the child is not cooperative, I'll write it down. The child was not cooperative, and everything that's been thrown. And I'll ask the parents to write. It's like a homework for them, whether the child slept, the time the child slept, and if the child who had difficulty brushing teeth, I'll ask them to make it write it down in the notebook when he allowed them to brush his teeth and all those stuff. So everything is written in a notebook. Even if the child comes for 4 or 5 years, we'll have a digital copy or the written document of everything that the child did. And every other 98th session, we'll have an assessment. And for the assessment, it is
Excellent.
very much compulsory that the parent, grandparent, whoever is looking after the child has to come to the clinic and attend the assessment. I'm very strict in those areas. So at least I can make them understand that these approaches are helping the child to improve. So that's how I could tell them that whatever I've been doing is helping the child.
Yeah, thank you for sharing that. I have been like, talking about documentation, importance of documentation for more than a decade, in my articles, in wherever I get a chance to speak. So thank you for doing that. You're doing an activity diary there. You're kind of capturing all these things. And it's very important because, then only we'll be able to reflect on something concrete and then able to see the progress. So beautiful that you're able to manage to do this and also like, give them a copy so they can also like have a record of the same. And
And
I
I'll
really
also
like, yeah,
sorry,
go
sir.
ahead.
I'll also do one thing. When they come to me and tell me like, he made me,
Yeah.
Inikavena pallitheka vittamna, I'll record it in my phone. Tell me again. Because I don't want you to tell. Illa, he didn't had an issue with brushing. I don't want you to tell me that. He never had an issue with. I'll record it in the phone and I'll copy and I'll have a copy under his name in my drive. So it's
Wow.
almost like saving myself for whatever I did.
No, no, I mean, like that's all like definitely an extra effort from a clinician side, but like you're doing great, and thanks for sharing those things. The other private practitioner may also like use some of these methods. Again, I just want to reiterate, documentation is super critical. It's going to provide us data to advocate for our field, to advance your practice, to measure client progress, to understand client issues in a better way. So documentation is super critical. And unfortunately, for a long time in India, the emphasis on documentation was always less. I mean, I was also a private practitioner in India for some time, and then like the first thing I did was like maintaining a separate documentation file for each client, and I was upholding that. So let's move on to Dr. Shobana Murthy now. Just one question now. Like, tell me the functional challenges that have been reported to you by your clients in the Indian context.
Thank you for that question, Karthik. And I don't have much to add what Sarika has said because again, like we bring that into one umbrella. It's the family-centered approach. So that's the highest challenges that or I suppose that any private practitioners in India would have that issue. I would like to also bring the other aspect, the operational challenges for a private practitioner, in Indian context. Like, because if I look back how I started my clinic in Chennai in 2012, as an occupational therapist, the first challenge that I had was how to register my clinic. Like, so that I make sure that my practice is safe to the community, and I provide a safety and like and confidentiality and things like that I learned in Ireland, and I wanted to apply that in India. So I didn't find any guidelines or any major legislations at that time. I understand that now it's been developed and improving and all that, but those time, that was the highest challenge I felt for running, I mean, like, even to start a clinic. That's number one. And also the policies and like collaborating with the other professionals wasn't that easy. For example, if I wanted to have a like understanding how the child is behaving in a school setup, it wasn't easy for me to approach the school, introducing myself as an occupational therapist, and I want to help. And there's always been, a stigma, or there's always something like, like, who are you, to question us? So So those were the challenges that I faced, along with, like from client perspective, I totally agree with what all that just said by Sarika. There was a huge challenge from the family. There's definitely, like many children were brought to therapy quite late, and I met many young parents who wanted to seek help sooner, but were discouraged by their own, like well-meaning family members, like especially the grandparents play a major role in Indian context, who would often say things like, oh, the child will talk when he is ready. Someone is in the family also spoke very late. And this is very common, and when this is very common, then imagine about a child, an autistic child, or a child with attention deficit or learning disabilities. So some of their disabilities are hidden, like, so it's very challenging in service providing perspective as well, especially when there was a strong social stigma attached to therapy, as if seeking intervention meant something is wrong with the child, rather than understanding that therapy is support for their children's development, so part of my role became just not working with the child, but gently also educating not only the families, but also the other professionals, like the teachers, the like the caretakers. In some cases, like children would go to creches, palwadi in Tamil Nadu. So I found that, like once we reach out to the people involved in the care of the client, in my case is the child, and empowering the people around them is the key thing to improve the overall outcome, for that particular child, or, like whoever is involved in the practice, so that was another, I would assume that
Great.
that's another challenge.
Yeah.
Yeah.
Got it. Thank you. Again, we started 10 minutes late, so we probably have another 20 minutes. So I'm just going to ask the next two, like one person from Mumbai and one speaker from Chennai, like Murli and Pooja, to just tell me how difficult it is for you to get referrals for to your practice. Number one, like what are all the pathway, the channels of referrals? Like how do you get clients, number one, and then how difficult it is to gain more referrals? If that may be a useful information for others to know. Whatever you could share. I don't want you to share any of your business secrets here. Pooja, you want to go first?
Yeah. So I'm from Mumbai, and Mumbai luckily has greater awareness about OT. And it's been my 15th year. So if you look at the years, I mean, when I started in 2010, there was little awareness, and I had to explain myself that what does OT do and how things happen. But um, since my given background of medical family, I have seen my father work of how to get referrals, you know. So
Got
I
it.
had been attending association meetings like Kandeli Medical Association, Borivali Medical Brotherhood, Malad Medical Association. So I've been members of these associations as well, and I attend their conferences, meet doctors, and that's a great way of introducing yourself to a medical fraternity at large in and as many doctors as possible. So I have given lectures there as well about how to identify and refer cases to me, etc. So, I mean, in one lecture, you are actually addressing like 50, 60 doctors across your area.
Yeah.
So
Excellent.
that gives you a shorter time, wide coverage kind of approach. And it's easier uh, if you are a member of those associations to approach
Got
them,
it.
because we have lots of cultural events in those associations as well where you can bond with these people as well. And being a sports person, I take that advantage as well. I play cricket with them, I play badminton with them, I play chess with them, carom with them, and they have these competitions as well, which has a greater attendance than the conference webinars or lectures that you give. So I do both. I give lectures as
Okay.
well, and I attend these sport events and
Excellent.
cultural, which gives me a great exposure. So
So,
that I've learned from my father, to be really frank. And That's how I gained the initial 5 years of exposure, and at a very great speed. And I was pretty settled and having a full day clinic right within the first 5 years. So that's how, and luckily I practice a pure, no referrals or no cuts to talk about. There's nothing. You send me because I'm good, otherwise you don't send me. That has been my practice since the start. So that way, that financial sustainability is not a question to me and my clinic. So that
Excellent.
benefit I can give it to my patients, that if they are not affordable, it's easier for me to tell them it's okay. You give however you can pay, how you can pay it, etc. Though I have put a cap on it as well, that I will be looking at only, say, 5 patients who fall under this much payment category. And once they are discharged, I'll take another 5, something like that.
So,
So it
great.
gives me a sustainability. It gives me that I'm not doing a charity because this is Mumbai and rents are pretty high. And given, this was as far as references are concerned and marketing is concerned, I have not done anything else. Yes, documentation. I have been giving reports, pretty good reports. And most of the doctors, when they see the reports, they do give me a call back saying that, oh, I mean, it was an excellent thing. So, and like how Sarika does, I do have a record of, I also keep 2 notebooks, one with me, one with the parents. And we record every session, every activity done, observations in a SOAP format, like a SOAP note. So assessment is every session. And our goals are very limited. We, after the consultation session, we sit down and narrow down it to 3 goals only. No more than 3 goals. Sirf itna hi dekho. And we are going to work on these 3 goals because these are the priority goals. And if we are work, passionately on these goals, the other goals will take care of itself. And most of the time it does take care of itself. So
Excellent.
identifying those 3 goals gives parents, clarity. They are not confused. They are not, you know, helpless. So what happens? Parents, when they feel helpless, is when they start becoming demanding, nagging, quick results chahiye, kya ho raha hai, and everything. And that actually puts demands on child and therapist as well. But I don't, I have like how Sarika said, we need to be strict. We need to have professional boundaries. We need to make a system. So I have a very clear system over the years I've developed, that this is the way things will function. This is the process. And I tell them in the very first session itself. I even have made a format, which is a write-up, which is kind of an informed consent form type of thing, that this is what this is how the clinic functions, this is the way you can connect me, this is how the payment will be done, this is how the sessions will progress, this is how the assessments will happen periodically, this is how the parent meetings will happen periodically, this is how, if demanded, the entire family needs to come and understand how things work, and how the parents and the entire family will be given a therapeutic role, that this is the prescribed role. आपको इतना मैं prescription के form में दे रही हूँ. This is for your child's therapy. There's no that grandfather will do this, the grandmother will do this, the father will do this, mother will do this. The roles are divided, and it is doctor's prescription. So
Excellent.
I mean, things work out really well.
Yeah, I think the
And it's a
powerful
division
message
of
you said
roles.
is, yeah, so be engaged in the local community to when you're starting your prayer practice, I think the powerful message is be engaged in the local community, so thereby you make yourself visible, and then once you gain your reputation, it's going to be a sustainable practice. Those are the
Work on
two
your
powerful
strength.
message.
I mean, use your strength. See, my strength is sports. I use it very so I get to play also, and I get to market also. I mean, that's how, I mean, and I'm a part of many of the sports community, which is exclusively for doctors. I mean, the entire teams are of doctors.
Yeah.
So
Shobham,
that works
I
better.
just see a hand there. Yeah. Thank you, Pooja. Shobham.
Yeah, sorry, I just wanted to add there. That was very excellent, Pooja. The way that you explained, like how you would prescribe the activities to the family members. I just want to add there that like that's one of the ways that we connect with the family. And what I do in my practice is, I don't well, I do prescription, but I do it like a co creation of the strategies, so I sit down with the family members, so we create what are the strategies as per the family needs, because I see each family functions differs, each child's family differs. So I sit with them, and we together create the strategies, what's going to work. And especially when we use terms like sensory seeking, like overwhelming, sensory overloaded, that they're gonna be like, out of your, so I include terms which are very day-to-day life functions. So let's do this in the routine. What does your routine look like? So yeah, I do agree that the activities with the family members have a major input. Thank you.
All right. So,
So just
Dr.
to add,
Muralikrishnan. Yeah,
just to
okay.
add to what Shobna ma'am is saying, that I agree with that, and I also ensure that the roles or the activities that are prescribed, they should flawlessly sit into the routine. I mean, if it is added thing, it's not going to happen. If it falls in the routine and it's a part of a routine, it is easily done. And the notebooks that we make, parents also have to record. We make a chart, and parents have to tick down ki ha kiya. It is just ticking, ticking, ticking. It's a chart that they need to tick. So it becomes very
Yeah.
easy for them कि मुझे क्या करना था, किसको क्या करना था. So there is no conflict within the family कि you had to do it or I had to do it. That accountability also comes. And definitely goals and everything, these strategies are definitely in coordination with the family and what family wants and how is the family routine and culture, because cultural variations do happen and certain things don't work in certain families. So you need to sit down and brainstorm, be creative, and you know
Yeah.
the
So,
creativity should be in your blood. No choice.
th- this conversation is contextualizing occupational therapy practice in the Indian, in the Indian context. So I'm so glad that we are doing this. Dr. Muralikrishnan,
Yeah.
just like, take 1 minute to tell me how do you get referrals? Like, just some high level points, and we will move on to the next one.
I'm very simple. From the beginning, what I started is, people who go and talk in the conferences, who go and meet in the conferences, do workshops, is the way you show people that your knowledge, your skill, and you can do stuff. So what I started from the beginning itself is I started conducting workshop. I started going in conferences, started giving speeches. So every school, every NGO, every organization who wants somebody to come and train their staff, train their students, or train their parents, I would go. And as of now, uh, every talk which I have done is for free. So I'm available for people who are in Chennai, especially the government institutions who send me for Andhra Pradesh and remote Andhra Pradesh and Karnataka, where I go and do it for NIPMED, NAEPMD. So what happens is that's the place where people who wants to see someone who can work, and I get contacts there and come. Of course, that's not the only place, because where you're going and you need to reach the other side of the community as well, or the referral sources as well. So the IFNR conferences or neuro rehab conferences happening here, and I also go for government meetings where I get all the medical college professors coming in, PMRs and neuros. So I get to connect with them more, and interact with them more, share contacts, and then this is how I do what I do. Luckily,
Excellent.
this kind of work what had put me in a very good spot in the map of occupational therapy. So I'm really glad I'm taking it up. Only unfortunate or only sad thing in my mind itself, as Shobna mentioned, people acknowledging therapy even at this point of time, I still have to explain people that what OT is. And even though we have reached the top of the top people in the country or in the state, we still are in that level, only because the people are not aware of occupational therapy until they need this. That's the only thing. The stigma factor is too much to go for. but we are breaking that stigma and coming out good. Soon we hope this becomes an open forum. They call, yeah, I finished OT and I go for it. That's the thing.
Excellent, excellent, excellent. So again, we are just because we are closing on time. I don't want to miss this question. All four of the panelists, okay? So reflect on your experience and give like what top three advice would you give for aspiring private practitioners in occupational therapy in India? Okay, so I'm going to start with Dr. Murali Krishnan. So top three advice you would give based on your experience as successful private practitioner.
Okay, first thing I would say is never ever think you're the best. You're still learning. There is this glass shattering noise all the time in your head. Every week, every month, every year, you will get that in your experience. You're not good enough. That's the thing. Of course, please don't get discouraged. Means go train yourself. If your basic scientific basic skill is very important. Therapy, you're creative and you can improve on, but the basic knowledge is definitely needed. That's the first thing. Second one is, when you are doing it, be very transparent, be very open about it. If you don't know, tell them you don't know, move on, and you will learn and come back and address that topic. Third one is be available for your clients. Be available almost all the time. Your personal time is, yes, considered, but when they want to talk to you, at least give them a way to reach out to you. You tell them, you, because they are desperate. There are changing generation of parents nowadays. The parents, what we saw in 2005, 2010, 2015 are totally different. Now they are totally different. So at this point of time, there is a lot of pressure on the child and on the parent, on the teachers. As Pooja mentioned, you have to have connect with everybody. So be available, be the person they can rely on you for their that particular moment of thing. So if they know you're there to take care of it, they will come back to you.
Yeah, transparent, customer centric, and lifelong learning, or be a lifelong learner. So great points. I'm going to ask the same question from with Dr. Shobna.
Well, added to what Murli said, I would advise the young practitioners to take your time, especially when you're trying to start a clinic, like learn a lot, like, and have a mentor. As Murli mentioned, there's, like go with like open-minded of learning. Number two, in practice, I would say that build that relationship, the trust from your family, from your, like the clients. That's very important because it's been, like more than 14 years now that I've started my clinic, and I still have great relationship with a lot of my parents. And they even now, like I'm in Ireland, but like even now they could reach me if they I know that they are just like desperate to get an answer or a support. I'm not going to fix anything there, but the thought that they got in their mind is, oh, I can reach Shobana to to signpost me what to do next. Even it could be a school placement, or it could be inviting for a birthday party, like their child, or it could be simple, or it could be complex, but they have you in their mind. I think that's one thing that I gained in my private practice, because you need to build that relationship. And for being like OT, I also say that apart from the intervention, look how to develop yourself too. As Murli was mentioning, keep learning, keep going on your learning. That's fine, but also how would you connect with the community? Like for example, like in India, we all have private practice, ourselves, but like there's the collaboration between the public sector. We are not connecting with them, and the policymakers, we are not connecting with them, and the educational institutions, we are not connecting with them. So I think like we need to look broader perspective of like how to take the leadership, or getting involved ourselves in all this, like because we all practice ourselves individually, but when it comes to whatever the child or the family, whatever, we are working for the community. So we need to have this collaboration happening. And I think that's something that we need to keep in our mind. Yeah.
Very powerful responses. Thank you. Thank you again. So same question. Probably the other two panelists have already thought their 3 points by now. So Sarika, go ahead.
Yes, sir. And I'm just adding to what Shobna ma'am said. We should have a constant relationship with the parents, even if the therapy is done. Because I remember asking a couple of parents, like, when will you stop calling me? And they say, like, until he get married. And after that, it's his wife's issue. So that until he gets married, I'll call you. And that's a kind of thing we should have actually, because their first hope and the first person that comes to their mind when they have an issue is us. So every time we had a child here and she spoke, she was only 1.5 or 2 when she came here, and they are in Dubai now. And every time she's a Carnatic singer now. She's 11 years old. Every time she performs on stage, the mother will send a video to me thanking me. Thank you, ma'am. The first word was from you, actually. So thank you. So we should have that relationship with the parents. And other thing, every new therapist should know is the legal areas of starting a clinic. I was not aware of anything. I just opened it. I asked a government officer who was nearby. I had a name for my clinic. Earlier it was different. And only after that, I know that the name was the same name. The same name, we had another clinic very close by. So I was not sure. Okay, then I had to change the name and then I had to go for the registration. And recently we had a fire accident in the clinic, in the office because of the short circuit. And luckily, I had fire insurance. And I don't think many of the clinics do have fire insurance, or we had a fire license done. So we didn't have to face much of an issue, legalities with that. So legally, we are not aware. None of the therapists are aware, especially the younger ones, are aware of like the legal formalities behind starting a clinic. And as ma'am said, they are just finishing the college and the very next day they're opening a therapy center. And it's almost like the parents who went there, they'll come back and it's almost like degrading our own, profession, names, profession. They'll come and they'll say like, they were just doing all the activities that was done in the preschool. So we stopped it. We just need speech therapy. We don't need OT. So again, we have to go to them and explain them like these are things. What is these activities going to do them? Because these questions they were not able to ask to those therapists. And even when they were asked, the answers that was given was not, the parents were not able to take it. So, and very unrealistic time frame was given for the children. Your child will be fine in 6 months. He'll start to speak in 6 months, and they'll come to me and say, they said she'll start to speak in 3 months, and you're saying it may even take 3 years. So does it mean that you're not a therapist? So I have to again tell them that no, these things can happen. It varies from child to child, and it varies from how they are brought up in the home setup and everything. It all depends on everything. So these things, I wish the younger therapists must know. They should at least take some kind of practice for 3 or 4 years from other therapy centers or hospitals to cover up all the areas. Just the pediatrics is more given. People just wanted to open a pediatric therapy center. Not many of them are aware of neurology or psychology or any part of OT that's been done. And one other thing is that I don't see many of the therapists who know basic first aids. So basic first aids, when the child is choking on a bead or something, they're just standing there. They doesn't know what to do. When there is a pulled elbow or something like that, we should know the basic thing. The basic first aid should be taught to all the therapists, which is very much lacking.
I think you elicited some powerful points here, very eye-opening ones, especially for aspiring entrepreneur. Thanks for sharing that. And definitely, I think there is a couple of opinion pieces that we could definitely write out of this entire conversation. I believe Suresh, be ready. And Pooja, last but not least, let's kind of wrap it up because we already well past that 1 hour. So go ahead and give your 3 insights that you want to share with the aspiring practitioners.
So one is all of the above. I mean, all the three panelists
Yes.
have already covered many of my points. So all of the above. But however, I would like to add certain things. See, luckily for me, about the fire safety, about the first aid thing, and about the shop registration, etc., was clear to me. I mean, because my father had done
That's
it, I did it.
background. Yeah.
He kept the degrees, I did it. He got the fire safety, I did it. Everything. I mean, so that was pretty easier for me over there, and I didn't had to figure those things out. But however, I had to figure a few things out that and about the financial literacy, about how to manage things and where to put a stop and where to have expenses, where to cut down expenses, etc. Should I mean so some basic financial literacy about how to invest, how to grow your money, because you can't rely just on the clinic, and what you're earning needs to grow as well. Then you can help many more people. So that's what something I learned over time. Then I thing is that I learned. I would rather say what I learned, because I don't know what to tell the youngsters. But I learned one thing, that I would never. We don't have to wait for things to change, about OT to get recognition or system to change or something like that. I think we should look at those challenges and take actions ourselves. That if every autist would, you know, uh, take up challenges and solve issues, you know, and don't compete, start collaborating. So I would because what happens is, if you start looking at things from your only perspective, however, all of us are facing the same thing. Why don't we come together and solve the issue? So now that doesn't mean that we only have to look at OTs as well. So over here, my collaboration is on to multiple professionals, be it pediatrician, be it psychologist, psychiatrist, everybody. So if I have a concern or a challenge, I will not hesitate to even ask a psychiatrist of, what did you do if this thing happened in your clinic? I mean,
Got
just
it.
pick up a call
Yeah.
and communicate and overcome that challenge, but take action. Don't just complain. I mean, I've seen youngsters only complaining, and that gets on my nerves. That why? I mean, you are capable. You have been trained. Definitely, mentoring or mentor seeking should also be one of the things that youngsters should do, because nowadays they just finish the education and they want to start outright. And I'm like, you need to learn few things. You need to have certain supervision and then go on. So that is there. And
Yeah.
clarity in thoughts, I would say. Um,
Yeah.
they just want to do pediatrics because everybody is doing it. But what is your liking? What is your clarity of thought? Why you want to do this? How
Absolutely.
are you going to sustain if it is not your topic of passion, or it's not something that you love? I mean, so the interviews that I take with the youngsters, my first question is why?
Yeah.
Why?
Yes.
If I don't get a
Yeah.
clarity, I send them home with a reflection that, please get this. There are many areas. I even, introduce them to all the areas and tell them, you need to explore before you want to settle down. Don't just get into pediatric OT because that's where money is many of times the answer is. I agree, but you can make money if you are passionate about it. So money can be grown anywhere if you are passionate. And that's how you sustain long in the field. Otherwise, you'll burn
Yes.
out within the first 5 years. And I've seen many of the clinics shutting down in Mumbai. They start with a very flashy and lots of marketing and lots of money burning and flexing and everything, but it's shut down within 5 years. Why? Because maybe that's not what the passion is. Maybe the clarity or the clinical reasoning of that
Mhm.
therapist is not that high. Maybe the collaboration is not that high. It's just competition. So that shouldn't be there. don't compete. If you're passionate, you will grow, you'll be successful, you will have money, you will have happiness and everything, and you will sustain long. I mean,
Very
otherwise,
powerful,
all it's
Pooja.
about is
Yeah.
there. That's it.
Very powerful. Passion and purpose, very, very critical for anyone to sustain in what they are doing. Excellent. It's been a great discussion, but I don't want to, if there is any burning questions that any of the attendees, like other than the panelists, if any of you want to ask the panelist while they are here, if you have, if we, we address very high level ones, but definitely we will continue this conversation more. But if there is any burning question that you have, I'll just gonna give 1 minute for any of you to ask questions to the panelists. All right. Hearing none. I hope this conversation was helpful. We will make this recording available on our YouTube channel. Definitely, we will continue to collaborate. I'm going to I'm already started thinking maybe touching base with each of these panelists and try to document some of their observations into an insightful opinion piece or article. Definitely we can tap within IOTT, and also any of you who are yet to become IOTT members, please join us. And if you want to collaborate on a project, please express your interest. We are happy to work. The bottom line is to empower the field of OT in India. So thank you. And I'm going to take the liberty to say some of these successful panelists here are I believe they will be willing to mentor any aspiring young practitioners if they need guidance. So feel free to reach out to them. They're kind enough to share their experience and expertise and perspectives here, and they will definitely do for any passionate, purposeful, aspiring, future OT entrepreneurs. I sincerely want to thank each of the attendees and above all the panelists for their time and sharing their expertise with us. Wherever you are, enjoy the rest of your day. Thanks for joining us today. Take care.
Thank you so much. Thank you very much.
So there is one question in the question
chat.
box, but however, that person can connect with me for understanding the legal aspects and of starting a clinic, or any one of us. I'm free to write that person personally. So
yeah, so Purva, please connect with Pooja. If not, you can also send an email to the IOTTT email, info@iottt.org, and we will try to circle back with the panelists and get that response to you. Thank you. Bye, everyone. I'm going to end the meeting for all.
Thanks all.
Bye.
Bye. Bye. Well done.
Bye.
Thank you, sir. Thank you. Bye.
Thank you.